Joining us now is Dr. Anthony Fauci, who, of course, has helped lead the U.S. response to the pandemic. Dr. Fauci, good morning to you on this momentous day.
Good morning. Good morning.
Before we reflect back, let's take a snapshot of where we are right now. The good news is that cases seem to be coming down and have been doing so since January. But at the same time, they seem to have almost plateaued at a pretty high level. I think the daily average of cases right now, 57,000. Is that a warning sign to you? And can you explain the implication of having a plateau like that at an unacceptably high level?
Well, that's exactly what happened a few times in the past. When you look at the previous surges, Savannah, that we've had in the late winter, early spring of 2020, and then in the summer, when you get down to a plateau that's as high as it is, 57, 60,000, that means that the virus is still very much circulating in the community. And when it is, then you get the possibility of being another surge. And that's one of the things we're concerned about. It is plateauing, but I hope it starts to, and I think it will, start going down at a less steep decline, but continue to go down. And I believe every day as we get 2 million or more people vaccinated, and if people continue to abide by the public health measures, we should be okay. Because as you know, we have variants that are circulating in this country that are a bit different than the original virus. We don't want them to take off on us and give us another surge. So there is light at the end of the tunnel. Things look good, but we got to keep putting our foot to the pedal when it comes to public health measures.
Indeed, and that's just where I wanted to head next, because at the same time, you do have states reopening, and some in pretty dramatic fashion. Texas swinging the doors open, lifting the mask mandate, opening all businesses or allowing businesses to open at full capacity. New York's going to open indoor dining to 50% capacity. New Jersey, too. Maryland's governor surprised a lot of folks, saying they're going to lift major restrictions. Is it too much, too fast? Are they playing with fire?
Well, it is risky, Savannah. I mean, I understand why they want to do it. No doubt about it. I don't want to be critical of it in the sense of saying they're doing something bad, but I think they really better be careful that it is risky. You remember, people have to get corporate memory. You remember when we tried to open up the country, open up the economy way back then. We gave the different guidelines. We had the gateway and the phase 1 and the phase 2. Some states just turned the switch on and opened everything up, and we had a big surge. We've got to be careful. At minimum, people need to continue to wear masks. At a minimum.
This is an inflection point. 1 year exactly since the WHO declared this a pandemic. 1 year since I think everyone in this country realized, wow, this is serious. And here you were at the briefing room 1 year ago talking about there being, I think, a handful of deaths, 27 deaths in the country, and you warned there will be more. If I had told you right then and there we would have 530,000 deaths in this country inside 1 year, would that number have shocked you? And honestly, how would you have evaluated the response in light of that?
Well, I have to tell you quite honestly, Savannah, it would have shocked me completely. I knew we were in for trouble, and you remember, you go back, I said it then, we better be really careful. In fact, that day at a congressional hearing, I made the statement, things are going to get much worse before they get better. And that was at a congressional hearing a year ago today. It was March 11th. It's 2020. I said that, but I did not in my mind think that much worse was going to be 525,000 deaths.
And when you look at it now, and there'll be plenty of time for hindsight, but this is a moment. What went wrong? It didn't have to be this bad.
Well, a lot of things, Savannah. I think people are going to be opining about that. It's going to be historical analysis of it for sure. But one of the things I keep hearkening back to that you can't run away from is that we had such divisiveness in our country that even simple common sense public health measures took on a political connotation. When people, if you wanted to wear a mask, you were on this side. If you wanted to stay in and avoid congregate settings, you were on this side. It wasn't a pure public health approach. It was really, very much influenced by the divisiveness that we had in this country. I mean, where we were saying mixed messages were coming from Washington, that's for sure.
With my kids, we do roses and thorns. We say what was bad in the day, that's the thorn, but we give a rose too. For you, what has been a high point in the response?
Well, the high point has been the vaccine. You know, we started working on the vaccine within days. The virus was recognized on January 10th. We started our vaccine effort on January 15th. And then 11 months later, we had vaccine going into people's arms of a vaccine that was highly efficacious and safe. So that was the high point when we got the results back from the first vaccine trial and found out we had a 94 to 95% efficacious vaccine. That was just an incredibly good feeling.
And finally, before I let you go, a version of the question I've been asking you for a year, again, like my kids, are we there yet? When do you think we are going to see this country return to the normal that we're used to?
Well, I think it's going to be gradual, Savannah, and I think it's really going to start as we get more and more people vaccinated. We know from the president that we're going to have enough vaccine to vaccinate everybody in the country by the end of May. If we really turn on the afterburners and get a lot of people vaccinated, the overwhelming proportion of the population, I think by the time we get into the mid to late summer, early fall, we're going to start seeing a big, big difference.
All right. Dr. Anthony Fauci, thank you for your time on this morning. Thank you.
Good to be with you, Savannah. Thank you for having me.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.